landed pretty hard as well.
Ouch. Oh, what happened? What happened? Whoa, that leg is wobbly weird. Painful human pretzels, knees that shouldn't be flopping, and arms yanked past their limits. Holy cow. Today, we're breaking down and reacting to some of the most gnarly medical moments and unexpected injuries from the UFC. Let's dive right in.
Yeah, landed pretty hard as well.
Ouch. Oh, what happened? What happened? Whoa, that leg is wobbly weird. Left knee going the wrong direction. Is the knee fractured? Is there a tibial plateau fracture? Is there a fracture of the patella or the distal end of the femur? Or is it totally just the connective tissue? Is the lateral collateral ligament totally just trashed now, as well as like the ACL, PCL? Hard to know. What's happening? Just trying to put it back in, it looks like. The biggest thing that you want to address right away is stabilization. So it's not moving, because you don't know if there's a fracture in there that increases the risk of lacerating the major blood vessels.
He's excited to have 25 minutes, test himself. Prove that he belongs in these big spots against the sport's best.
Oh. Finger to the eye, painful. You can scratch the cornea, you can rupture the globe, or you can cause a bad laceration to the cornea as well. If you injure the sclera, it could get red, but it doesn't have as many nerve endings as the cornea.
Oh, it was a poke in the eye. Yeah. It wasn't a low blow as he landed the body kick.
Over there.
Okay, so
over there.
You gotta see the replay,
Oh, no.
because last time.
Oh no.
Uh-oh,
my
that's
God,
like
this was
bad.
one.
The worst is if you have a ruptured globe. That's when fluid starts coming out of the eye. You don't want to touch the eye. You want to keep it protected and covered, because you want to save as much of that fluid as possible to get to the ophthalmologist so they can do surgery on your eye and fix it.
To the left, not towards the fence if you're Woodley to get that guillotine.
Flank pain in the setting of squeezing pressure. You'd think, okay, does he have a fractured rib, injury to the spleen, unlikely kidney, because the kidney's on the back side but could still cause pain on the flank side, and then is there any issue with the lung? So those are all things you would look for.
One of the best welterweights on the planet, and you got to think at some
passes over, and then something happened here to Tyron Woodley's rib.
Treatment of the fractured rib is the same as if you have a bruised rib. Pain medication. We want you to take big, deep breaths and make sure that you're moving the air, because you increase the risk of getting a pneumonia. Oh, we're getting some pop. Oh, forearm. Goodbye. Or muscles. Woo! You see that forearm gets extra movement that you don't normally see. It could be your flexor muscles of your forearm. You can rupture those. So you've seen somebody who's ruptured their pec or their bicep. It pulls and just like kind of disappears. Same idea with the forearm.
Is that a broken arm? What is that?
Now that certainly looks like it snapped. You're right, Joe.
But his arm isn't swollen.
No.
You know, I mean, I don't know if he's playing it off like it's okay.
You could have it severely spasm so bad because it's in that position and ball up as well. Or again, you can fracture one of the two bones of the forearm, the radius and the ulna.
Takes Whitaker down. Lands a couple punches here. Look at this. Whitaker almost panic taps.
Getting choked out.
Choke, locked in.
I've seen people get choked out in 1 or 2 seconds if the pressure is significantly high and it just hits the right area, versus cutting off somebody's airway, causing an issue as well.
Yeah. That is how hard he got that choke. Whitaker starts pointing to his jaw.
Oh! These are the incisors. We have 4 of them in the front, but we see 3 here. You can see that they're massively displaced or pushed into the mouth. That probably means that there is a fracture of the chin or part of your mandible. You want to use all the native tissue and get this back into place and splint it in place.
Tate's got to get herself moving and get out of there. The ref's
Ooh.
gonna step in.
Rousey going to work on the champion from her back.
Looking for the arm again. Here she goes.
Oh no!
And again now transitioning to the arm.
These UFC injuries are next level painful. Even just watching them might have your stress levels through the roof. That's where Chillax by my company Life Happens could help. An occasional stress support supplement. Check out Chillax at lifehappens.com or on Amazon.
Less than a minute remaining in the first.
Oh!
Ronda Rousey extending the arm.
The likelihood of a fracture there, it could happen because of the hyperextension and you're snapping it. You can't go that much further. These individuals have strong bones, so you'd really have to hyperextend it to snap it in that direction, versus most of the time when we see the fracture of the elbow, it's typically due to direct trauma landing directly on it.
She's got to squeeze her knees a little bit.
Ooh, the elbow doesn't look good.
Hanging on, desperately trying to survive.
Deformed elbow. Did it fracture or is it disarticulated or out of socket? When fractures happen in the elbow, typically it's related to the olecranon process, so part of your ulna.
Oh, she's going to break it.
Here, you're seeing it pop forward. You think, okay, maybe there is a rupture of a ligament, typically the annular ligament relating to the radius. It also can slip out, being dislocated. What we're setting up here. Holy cow! Look at all the red stuff. Holy smokes, the poor lady's face. She's got a laceration somewhere causing all that bleeding. I will tell you, the head just bleeds a ton. So vascular to our face, and that's why we don't get a lot of infections to lacerations or injuries to our face, but that's a whole other reason why we bleed a ton. Wow, you can even see the blood just dripping on her own leg. Even if it's not arterial, it'll just keep dripping. When somebody comes to the emergency department, direct pressure to the area, get the bleeding to stop, we'll inject lidocaine with epinephrine, just because the epinephrine will cause the vasoconstriction to get the bleeding to slow down as well. Oh yeah, big laceration over that area. The massive hematoma underneath the right eye, the likelihood of that area is there's probably going to be a small fracture of the infraorbital wall. That's quite common for that much swelling versus just soft tissue swelling. And then you see the big laceration going over the right forehead, over the right eye, as well as a laceration to the lateral aspect of the right upper eyelid. The aspect that would be the most concerning, right in that area, you have your lacrimal gland where you make lacrimal stuff. No, that's where you make the liquid for your eye. There's a lot of lacerations to this individual's face that need to be repaired. They're doing a good job with bleeding control. You accidentally sew it up too tight, or you're not conscious of how deep you're putting your sutures, you can suture the lacrimal gland to a point that you cause it to not function the way that it should. What we end up doing is sutures for the face. We'll do either 7-0 or 6-0. The higher the number, the thinner the thread. Oh. Looks scarier than it is. That's just subcutaneous tissue. We're not just suturing the skin when we're actually putting this back together. You're taking bigger bites, getting all of the tissue to come together, because you don't want a lot of surface tension right at the skin. You want to approximate the edges and the body will heal itself. Awesome UFC fights. If you guys enjoyed this and you liked my reaction to it in the sense of learning something and being educated on some of these injuries and what to do for yourself in the future if anything were to happen, let me know in the comments. And do me a favor, if you enjoyed it, definitely check out this playlist and watch everything, binge watch everything. Make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.